Thank you, Dr. Devamala, Dr. Vinita, and Sahani sir. Good evening, good afternoon, and good morning. This is the 1466th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and we have a guest from Pakistan, Dr. JAVED AKHTAR, another legend from Pakistan. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have doctors and eminent personalities from 65 countries are present at various subjects and papers on this forum. And we have 3 sessions every day, 7:30 to 8:30, our Hindi session just over, and 8:30 to 9:30, the international session in English, and 9:30 to 10:30, we have a local language session in Malayalam. As you all know, today we have a guest that is Dr. JAVED AKHTAR from Pakistan, a person who is whose life is dedicated to homeopathy and always here with the International Forum for Promoting Homeopathy to uh, be a guest or a participant or a whatever may be. Sir is supporting us all the way to promote homeopathy among different countries also. And Sir has completed BHMS and BSc Clinical Pathology and MPhil in Physiology. And he's a mentor, he's an ex-member National Council for Homeopathy in Pakistan, and ex-chairman of Professional Development Program of Homeopathy Government of Pakistan, and a person exploring the works in homeopathy, has won many awards from different parts of the world and has presented different subjects in various forums, as well as having many years of teaching experience. This is what we are always here to present cases. It's single remedy presentation, why this remedy was selected, what are the rubrics, how the rubric is different from the another. This is the way Dr. JAVED AKHTAR teaches in this forum. And every day, sir is giving a lecture on a rubric in his YouTube channel also. So we proudly welcome our beloved guest for a presentation, a case of squamous cell carcinoma, a malignant epithelial neoplasm, left submandibular lump of neck treated with homeopathic medicine. We let us proudly welcome all of you as well as the guests. Thank you. Welcome, sir.
Thank you, Ji. Thank you. First of all, I'm going to thanks to all the dignitaries, all the respectable homeopathic doctors, international dignitaries, well wishers. Uh, Today, in the especially International Forum for Homeopathy, I'm going to especially thankful to oblige. They given me opportunity to present my research data and clinical data to share the all the for human beings. Today, I'm going to present my such a case which is the especially fatal disorder. It is a very you can say that if you treat in the other side of system, it is a so tremendous type of the vulnerable over there the treatment and the prognosis. However, you can see here today such a fatal disorder I have treated with a single homeopathic remedy. When you will see such case and your faith on the homeopathy will be enhanced. Thank you, please. So the case basically most of the I am going to share here. I work over this such cases which are the too much fatal and acute emergency cases. I did a lot of work. Behind this, what is the because I am a physiologist and my other designation is the clinical pathology. Both of the department I have and, degrees and education over there. Therefore, I know it. Okay, what is the depth of the disease? Therefore, it's a blessing of special Allah for me. I can do such deal with such fatal cases. So the case is here.
Yes, sir. We can.
Okay, you can
Listen.
see it.
Yes, sir.
Okay.
It's good. It's good.
Thank you, Dr. Vinay sir. You introduced very beautifully. Thank you, sir. So the case is the squamous cell carcinoma, and it is basically it is a further type malignant epithelial neoplasm. Squamous cell carcinoma may be found in different regions, and this cancer arises from the epithelium from the of the sub mandibular glands. So I have treated this case with the homeopathic medicine. The abstract of this case reported present the treatment of squamous cell carcinoma, SSC, abbreviation is the of submandibular gland using homeopathic medicine. A 68-year-old male patient with history of diabetes and significant family history of cancer presented with form non-tender mass under the left jaw. Despite conventional recommendation for surgery and radiation therapy, the patient opted for homeopathic treatment due to concerns about the invasiveness and potential side effect of conventional treatment. The homeopathic remedy arsenic album was selected based on the patient's mental and emotional state, particularly as fear of cancer, anxiety about headache, and concern for his family's future. Over the 8-month period of the patients underwent regular follow-ups during which significant improvement were observed. Understood and ultrasound reports demonstrate a progressive reduction in the size of the hypoechoic mass, with the tumor eventually becoming non-palpable. And additionally, the patient reported improvement has emotional states, energy level, and overall well-being. This case highlights the potential role of homeopathy in the holistic management of malignancies like SSC, particularly for the patient who prefer non-invasive treatment options. The successful outcome in this case suggests the individualized homeopathic treatment can lead to significant clinical improvement and tumor regressions in certain cancer patients. Further research and clinical trial are needed to explore the broader applicability of homeopathy in oncology. Squamous cell carcinoma is a type of malignant epithelial neoplasm originating from squamous cells, which are flayed, scale-like cells found in the outer layer of the skin and certain mucous membrane. When SSC occurs in the submandibular gland, it represents a rare and aggressive cancer from given the atypical presence of squamous cell in salivary gland. What is the anatomy of this? Basically, I'm going to tell some anatomy background of this disorder, this cancer. This is the submandibular glands suited beneath the lower jaw on either side of neck are major salivary glands. They're producing saliva crucial for digestion and oral moisture. These glands consist of acinar cells, which produce enzyme-rich fluid, and duct cells, which transport saliva into the mouth. SSCs are submandibular gland arises from squamous epithelial cells, which are not normally present in the salivary glands. The presence of SSC here usually indicates a pathological replacement of the normal glandular epithelium, potentially triggered by chronic irritation, inflammation, or exposure to carcinogen like tobacco or alcohol. And etiology, what are the etiology and risk factor? Chronic irritation, persistent inflammation of prior benign tumor in the area, tobacco and alcohol, radiation exposure, human papillomavirus. These are the commonly which are the present. Clinical presentation. Patient typically present the swellings, persistent form mass in the submandibular region. Pain may radiate to the ear or neck. Dysphagia, difficulty swallowing, especially with solid foods. Ulceration, large tumor may ulcerate through the skin. Numbness, weakness, special nerves involvement can cause numbness and weakness. Diagnosis. Diagnosis of a clinical examination, physical assessment of the head and neck, imaging studies like the ultrasound, CT scan, MRI, PET scan to evaluate tumor extent and metastasis. Metastasis for the PET scan. Biopsy, fine needle aspiration or excisional biopsy to confirm the actual diagnosis. Macroscopically, SSC characterized by the keratinizing squamous cells, abnormal cells producing keratin. In vision, tumor cells invading surrounding tissues, cellular atypia. Abnormal cell shapes and size with high mitotic activity. Stromal reaction, desmoplastic stroma, fibrous tissues reactions around tumor cells. Staging and grading. Staging based on the NTNM. These are the special system, tumor node metastasis, how much they are metastasis. These are the called, this is called staging. Grading, different low grade, well differentiated to high grade, poorly differentiated. And treatment. Conventional treatment typical includes surgery, subneural brain, and potentially neck and dissection, radiation therapy, then chemotherapy, and these are the routine therapy. So here I mentioned is homeopathy therapy. Normally, you will not see here and there the word homeopathy. So in future, with the blessing of Allah, with the cooperation with the homeopathy community, inshallah, we will in future everyone will write the uh, treatment plan. They will write over their homeopathy too. Prognosis and depends on stages and diagnosis. Early stage tumor have a better outcome. Tumor grade, high grade tumor are more aggressive. Treatment response. The effectiveness of initial treatment significantly influence prognosis. Now I'm going to come to this was the previous information about the cancer and especially SSC and epithelial neoplasm. Now I'm come to the homeopathic case. Patient's name is MT and 68-year patient's age, occupation is a salesman, and medical history diabetic from 9 year. And what's the onset swelling under the left jaw noticed 3 months before consultation. What were the symptoms? 3.5 symptom form, non-tender, fixed mass, difficulty swallowing, mild pain. These are the complaints of the patients. Clinical examination and finding non-tender mass in the left submandibular region, non-skin changes are regional lymphadenopathy. Ultrasound. So secondly, the diagnosis, what you will see then, you can go with ultrasound and other certain tests, what kind of tests are needed. Ultrasound bilateral thyroid nodules suspected pleomorphic adenoma. It was the first ultrasound that definitely shows on the ultrasound pleomorphic adenoma. And then Astrology diagnosed on that when the tissue is taken. Normally, a doctor prescribe FNA, but here it will look like something. So patient advised by the doctor to taken the biopsy, and it was a malignant epithelial neoplasm. And CT scan left parietal gland mass, possible metastatic lymph node. And conventional treatment recommendation, it was recommended by the orthodox system of doctors, and they advised the decline by the surgery, and patient advised to decline. They did not respond it, and they declined by the patient in favor of homeopathic treatment. So now I'm going to the case, especially what is the version of the patient, and there are different methodology and protocol used when you are taking the case. So here I use the Segal protocol. These are the Dr. Segal. I salute him, Dr. Segal. The patient responded. So the patient when was visited to me, so I asked it. So what's the issue you are experiencing? The patient gesturing around the back of the ear. Just he says like that. We must see it. The observation in homeopathy is very important. There is a growth here. I had all sorts of tests done, and you can see the reports. Initially, I felt pain in my left ear, and after about 15 to 20 days, I noticed the growth just before the ear. So what the doctor said, is there anything else? Patient, this is the main issue. I also have a diabetes. Because of that, I experience knee and joint pain. I have difficulty urinating in the early morning, and there is pain. I also urinate excessively at night. So the doctor asked, how long this has been happening? Patient, about 2 to 3 months. And the diabetes has been ongoing for about 8 to 9 years. So doctor, okay, what kind of work do you do? I work in a car tire shop in Lahore. Then how many people are there in your family? This is a very tricky question. What the patient respond with it. This is especially for the new learners. And how many people in the patient? I have one daughter. My two sons passed away, one about 1.5 years ago, and another when he was around 8 years and a half. My wife also passed away in 96, around 30 to 32 years. I also have a daughter-in-law from the son who died Definitely one son was married and uh, those who died 2 years ago. He has a son and daughter. Yeah, these are the granddaughters. He passed away due to liver cancer. So this is the history and family background of this. So, did you experience any tension or stress before it appeared? Patient, there wasn't any particular tension. Okay. Any stress related to work? Well, there always some stress that comes with work. Okay. My question is 3 to 5 months before this, this started, did anything specific happen that caused you stress? Patient, no, 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 nothing like that. I was just sitting in my shop when I felt the lump. Not okay. So tell me now that you are in pain. Is there any tension? Actually, the word pain is not only just feeling the pain. It's a pain like you can say your panic, your tension. This is a specific word for the emotional, mental level too. Any tension or stress right there? There is pain in the ear, pointing to the ear. The doctors say that the growth is cancerous. Okay. Is there any stress because of this cancer diagnosis? Everything revolves around cancer. Patient says, so everything. My wife died of cancer. My son too. And my youngest son and had brain cancer. We had surgery for him, but he also passed away. Now I am scared of this cancer. Everyone in my family who had cancer died, and I fear I will too. Okay, so you are worried that, like the rest of your family, you might die of cancer too? Yes, but who want to die? Who want to die? No one. After all this happened in my life, I think this cancer is just another take, like what happened to my family. I don't have any other fears. I just want this to be treated and cured. I'm afraid that if undergo surgery, the cancer will spread even more. Okay. When you found out it was cancer, what did you do? Patient, I took the prescribed medicine for about a week. Then my doctor suggested we go to Islamabad. This is my city. I'm working here. And given what happened to my family, I have come to believe that surgery or chemotherapy makes this disease grow and spread. I have been stressed since I got the report confirming it's cancer. My diet, sleep, routine haven't changed, and my mood remains the same. I just want to treat and cure. Patient, okay, patient doctor, now she's talking, but with the patient, it feels like this disease is a family curse. Everyone says his wife had cancer, his son and had cancer, and he does too. Oh, I worry that I might be next. This is the version of the patient's of the daughter patient. Okay, I have seen this disease in my family, and now I think the same way. Everyone will die, but this disease would not go away. I don't want to depend it on another. Here, patient, what to say? I have seen this disease in my family, and now I think the same way. Everyone will die, but this disease wouldn't go away. I don't want to be dependent on others. Okay, if I die, I want to remain self-reliant until the end. Now I'm concerned about my grandson and granddaughter futures. I want them to be family educated and good people. This is my main worry. I just pray for treatment and cure, not just for myself, but for everyone suffering from this disease. Okay. So patient doctor, uh, this disease has been in my mother's family. Her mother had it and died from it. She had six daughters and they all died from cancer. She had two sons who also died from it. Now it feels like a family battle. We say this problem came from my mother's side, but now none of my father's side had this issue. So why did my father get sick with this disease? This is a question of passion. All my aunts and uncles on my mother's side died around the age of 25 to 6 years, 26 age of leaving behind young children patients. I just want to be cured and healthy. I want to take this medicine and be cured right here. Okay. Patient says, I want to take this medicine and be cured right here. I pray that Allah keeps me away from this disease. This is a basically case. Now I'm open this case. Okay. So here I'm going to mention here one thing. There are different methodology you can take the such cases. So here I use the cycle protocol. There are two things very important when you are taking the such cases. One is the triple P and second is the CAR. What is a CAR? CAR means concern, adaptation, reaction. Concern means what is the in the concern means apprehension, anxiety, fear are found. What is the concern? This is here mentioned. Second is the adaptation, how this disease comes. What was the situation? What was in generally before this, it was the word we are using cause. Now it was the right word is the adaptation because cause can be finished. If someone cause, it should say cause, but cause is not carry on. So, the right word is the adaptation, and third one is the reaction. What's the reaction to the such when the patient suffer, and what is the reaction of this patient? These are three things over there, and you can ask, and the patient you are telling me, and you have to notice these things. These are the car. And what is the criteria to evaluate the patient? There is a triple P, present, persistent, predominant. One symptom should be present. It should be the one symptom should be present, and it should be continue, persistent, and should be important, predominant. Three things should must be there over there. So so I've taken the case, and what was important when I've seen for the patient, and then I've seen this in the patients. So I'm going to tell you here. The first symptom I have taken here, patient version. I just want this to be treated as cured. I'm afraid that if I undergo surgery, the cancer will be spread even more. I just want to be treated and cured. So here this word, I just want to be treated and cured. Carry desire to be carried. The rubric is carried is word. I'm afraid that if undergo surgery, the cancer will spread even more. This is you can say this is a reasonable. You might, being a doctors, you know it. When you cut the cancer, and cancer, most likely it is a spread out. This is a scientific evidence. So I took the rubric as objective reasonable. Here is another oh, so one rubric I have taken in prejudice, but I'm explaining more. Okay. Second one is I have seen this disease in my family, and now I think the same way everyone will die, but this disease wouldn't go away. I have seen this disease in my family, and now I think the same way everyone will die, but this disease is go away. So I took the rubric cancer, fear cancer of incurable of being, definitely ये disease जो थी that उसके साथ होती है the third general disease of incurable sum. Basically, the crux of this version is the this. And third, I don't want to be dependent on others. There are different two type of rubrics. So I don't want to be dependent on others. One rubric is fear dependent of others, maybe disease of depending. But here another rubric, fear disable of being, because the patient is saying, I don't want to be dependent on others because I don't want to stay disabled because the cancer will not work to me. So I took the rubric is fear disable of being. And third, next version is I am concerned about my grandson and granddaughter's future. I want them to be well educated and good people. That's my main worry. Anxiety, family about it, and don't anything, nothing to happen to them. Fear happen something family to his. This is another rubric of this. And next version is I just pray for treatment and care, not just for myself, but for everyone suffering from this disease. So I took the rubric praying. Next version, I want to take the medicine and be cured right here. I pray that Allah keeps me away from the disease. So I rubric here, I want to take the medicine and be cured right here. Carry desire to carry fast. And next one is the praying. Okay, here is the rubric prejudice. I'm going to explain. Just want to be treated and cured. I afraid if that I undergo surgery, the cancer will spread. One is the objective reasonable. Third, patient I had a mindset, definitely is will spread out it. This is the basically mindset of the patient. So I took the rubric prejudice too. One is objective reasonable, it is the evidence based. Number two, prejudice. Patient has a mindset, it will spread out. May not spread out, but it is the mindset of the patient. So these are the rubrics. Another which I've not mentioned it, but that basically what was happened. There many people's are deaths. There are different type of the rubrics you can take here. Just I'm going to come to this side. Here, ailment or death of loved. There are different type of the rubrics you can take. Ailment of death of parents, and ailment death of the death of children and loved one, death love and one to another. But here is a daughter-in-law, grandson, wife, and whole family. But not certain people are not included in family, so they are included in the loved ones. So I took the rubric is the appropriate rubric is a loved one, because all are the loved, but not is a certain people are not present in the family, not the children. So I took the rubric. And prejudice, carried that to be carried, fear death of cancer from objective reasonable, fear cancer of incurable, of fear being thought disease of incurable, fear disable of being, fear happens something family to anxiety, family about praying, carry disabled, carry fast. So medicine comes arsenic along. So, so these are the rubrics which are taken over there. There's a chart of the radar opus. And now I'm going to share about this. Okay. The arsenic album. It was a single protocol on basis of concern. These are these SCAR and triple T. Repertory synthesis and mercury. I've used the synthesis and mercury repertory. Software is a radar opus. PG information. And next one, what is the follow-up? These are it's a first case. I have basically, physically, it was not patient so worse condition, but the mentally definitely so a lot of the apprehensions were there. The cancer is there, and what the doctor recommended that there is surgery. First is surgery, the whole area to be definitely, and then the chemotherapy, radiotherapy are these there. So I have given the medicine, and after the 1 month, basically you cannot feel the respond in the days, and I called the patient after 4 weeks. So follow up and ups and progress. First follow up, decrease anxiety and pain. Swelling remains stable. Second follow-up, this was the first follow-up. Second follow-up, 1 month, slight reduction in mass size, improved emotional state. Third follow-up after these are the 1 month and 1.5. So continued reduction in mass size, further emotional improvement, further follow-up 2 months, further reduction in mass size, ongoing improvement in energy level. Fifth follow-up, marked reduction in mass size. Sixth follow-up, significant reduction in mass, no longer palpable. And what is that? Basically, I'm going to tell you whether the patient visited to me, what was the size of the lesion size. Sorry, this is the word lesion size for January 1st, January. You have notable 1st January 2024. The size was 30 into 23.26. These were the Lagrange lymph node. Describe the lesion. These were the MRI. And then the patient go to the ultrasonography. It was the size after the 10 days. Okay. The size was 37. You can see here the size 30 to it was increased 7 millimeter. Then it go to the CT scan at 17th. So after these 6 days, it was 38 and 25 and 23. So treatment started was 22nd. So it means this size was, it means 22nd means 17, and you can see it 13 days and 22 days. So you can say it was 35 days. It means this size was increasing. It means before 35 days, I did not have such ultrasound before treatment started. It means the gap was before this was the one. If you can see MRI, so here the gap of this 1 month and 21 days. Okay, it means the size may increase. Therefore, I did not see. What was the size? Here I'm going to mention here hypokic size. Just I made the comparison chart here. Uh, it was a size 38. Sorry, this chart is a little bit not clear. Just wait. Here you can see is uh, sorry for delay. 22nd February 22nd, when the patient first ultrasound. 38, 25, 29, 19. This was the size of hypokic mass. In right lobe size also nodules were also there, 74, 139. And left lobe, these are basically when cancer over there, and left lens also size increase. Isthmus size 3.4. These were initial assessment from the patients. But then after the second visit at the April, the size 38 to reduce become 28. The previous data was actually not present 1 month and some days. And April, this was the second visit. It was size reduced to 38 to 28 and 25 to 17. These are lesion size. Okay, 19 to 14 point. And then after at the May, any after third visit, the size become more or reduced 28 to 26 and 17 to 13 and here 10 millimeter. Here this size also reduced. In the next fourth visit, the size is 26 to 22, 13 to 12, 10 to 9. And in August 19, it was a first, second, third, fourth, fifth visit. It was sized to 20, 20, 12, 8. Okay. And here the glandular size also reduced. Here at the first visit, 74, here 30 to 20. अच्छा left lobe 19 to 12 and 3.6 in normal. So it was a millimeter. It was a millimeter. So here the size becomes so reduced. The patient physically there you cannot see the size. And I hope in 1 and 2 months after this it was or totally reduced. The patient symptom was not there. And all the investigations I've done over there, they're absolutely normal. And another test I'm going to share here. What kind of the response of this test? So here report of this ultrasound of neck. These are the you can see here. These are the basically the ultrasound of the neck. Okay, is here bilateral thyroid nodules MNG here mentioned here. And next is these are the report of the Department of Radiology. CT, these are report here. This mention is the mention here. The regional. These are the basically the metastatic they are mentioned over there. And these are the histopathology report. Basically, these are the very important report in histopathology. They mention over there. So this is the left submandibular swelling, malignant epithelial neoplasm in the Hest biopsy report. Malignant epithelial neoplasm, and they are also this before this Squamous cell the type is of this. Okay, these are the diagnosis, exact diagnosis. You can say no differential include peptide carcinoma, less likely squamous cell carcinoma. So it is a malignant epithelial neoplasm. Here is the reported, which I mentioned over there. You can see it is the properly reported. Basically, it is the evidence base at February 22nd. These are the mention of the size over there. Okay. This is the size 20, 38, and the 38. And next one is the size of this April 26. This is the size 26, 67, 27. These are the right lobe. And here is the mention is the 35 into 24 largest. Okay. And next is the this is May. And here is the size of the measuring 35 to 25. Okay. And then is the this size. This is July. It's the before last visit. And this well-defined hypocrite region 22 into 12 and 19. And last one is the Ultrasound of the neck, this is a 20 and 12 and 8 size. Okay. And then now I'm going to discuss this case. This case is state the potential of homeopathy is treating early stage squamous cell carcinoma, malignant epithelial neoplasm, particularly when a patient is strongly opposed to conventional treatment. The remedy arsenic album was selected based on the potential mental and emotional symptom. Totality of symptom method used Segal protocol with the help of radar focus BGM and treated resulted in a significant reduction of tumor and marked improvement in the patient's overall well-being. And this case demonstrates the effectiveness of homeopathy, particularly the remedy arsenic treating SSC of the submandibular gland. The patient experienced significant tumor regression and improvement in mental and emotional well-being, reinforcing the potential of homeopathy treatment in managing such complex conditions. Regular follow-up and careful cases management were crucial to the successful case. Thank you. It's so nice to do this. This was the now it's on to you. You can ask any type of questions over there. The floor is on you, please.
Yes, really a very good size. Nobody could believe that a homeopathic medicine can do such wonders with a single remedy. That your arsenic L6 is something great. People believe that we have to go with a medicine for this.
I left some clue over there that you can ask the questions if you
Yes,
love the homeopathy.
yes, sir. Sir, what is the uh, concept of miasm in this case? How will you
Actually,
describe?
this is a very important question. Basically, in my point of view, when I've read all the books, miasmatic basically it is a theoretical portion. It is a theory. Just like in allopathic science, this is a chronic disease, this is acute disease, and this is a such disease. And when they are treating, they use the, for example, if the patient comes with a chronic disease, you can use antibiotic. If patient comes from the acute disease, you can use it antibiotic too. Painkiller and so on, same, so all of the cases. So basically, it is the my doctrine is with the practical exposure. I did not use such anti-miasmatic, which remedy is not anti-miasmatic. Now I am questioning you. Which medicine is not anti-miasmatic? All the medicine are anti-miasmatic. So you have to select right remedy, number one. But problem is here, we are certain time confused about the potency. Certain time it was LM potency, certain time it's called low potency and high potency. And next, this is a question of the miasmatic. Why I am not using anti-miasmatic in certain why? Because it is a theoretical, not a practically.
Yes,
Tuberculinium used when the patient is a tuberculinium. Carcinosum used when the patient is a carcinosum. Homeopathy, Dr. Segal, sorry, Dr. Honeyman, Master Honeyman, who says you can use one remedy, single remedy. Never you can you read all the frozen. He did not mention. He strictly prohibited. You cannot go one more than one. So the remedy is single.
yes, sir.
However, if the patient is having the chronic disease, meanwhile, patient can suffer with certain acute problems. For example, patient is a cancer patient, but patient is suffering from fever, from headache. Now you can give the remedy at that particular time, and patient will the fever will settle down, headache will settle down. Then you go to the main remedy.
Yes, sir. Exactly. Every remedy has three phases. One is soric phase, then psychotic phase, and the syphilitic phase. That's why when you choose the right remedy, it works in all conditions. That's why you got the result in such a beautiful case of we used to say that it is a psychotic as well as cancerous condition, cancerous miasm, all those things together, but it works and no, it is back in the soric state, I must say. Not in the soric state, but what you can observe during a soric state, there is no swelling in the beginning, just like that. Anyway, reduction of simply not reducing the size of the tumor, but there is no metastasis also. That is the beauty of the cure. That's what we can call it as cure, sir. Congrats, sir. And we are very happy to have such a wonderful presentation on this Teachers' Day here. And you are a big guru for all of us here. So, we salute you, sir. And it's over to Dr. Beatrice Gerstner.
You're welcome, ma'am, please.
Yes, Dr. JAVED, I'm very impressed and many congratulations for such a beautiful case and such a successful case. And for me, it really was so impressing. All the family with cancer from the maternal side, but the sons with cancer dying, the wife dying, that is something very special. So very interesting to cure that a person with just one remedy. Arsenicum album, of course, is a multi-miasmatic remedy, as we are discussing. And Dr. Danish, he's very right. What is a miasma here in that case? Because it is a strong, strong cancerous miasma. And but one question, excuse me, just to get it right with the potency. You said it was Arsenicum album C6, or how was the potency?
Okay. Here I use the potency. Thank you, ma'am. It's a very beautiful question. What the potency is needed in this case? Okay. Just I'm explaining what potency is needed when the patient is suffering any kind of disease, either it's chronic or acute. And basically, the exact mechanism which I understood it, the intensity of the symptoms. If the
Yes.
symptoms are too much intensified and patient is too much restless and too much, that you can go up and if the patient go to the anguish level, then you go to the highest potency. Okay. If the patient's having no physical and restless and but disease is chronic, and you have to care such diseases with gradually. You cannot treat it immediately, and you will be go to the small potency, and small potency will work gradually. It will reduce it. If you will give the instant remedy, high potency, and fear is the background is over there, but fear does not intensify. The patient is having the such fear, but the intensity of the symptom is not like the panic attacks, not over there. Therefore, I select the small potency. And small potency, and certain people are said it should not use too much frequently, but I have used here once a daily.
Once a
OD
day.
dose.
Arsenicum
Once.
album C6 for all the
Six.
weeks without stopping? Without?
Yes, I'm coming over there. And initial days, I used this once a day. For the first month and second month, it was alternate day. And
One
it
day
is
yes, one day
stable.
no. Okay.
One alternate day. And regularly it was alternate day. Even end of days, I use was third day. 2 days gave. And at the fourth, last month, I gave over there 4 days.
Yes, I understand.
4 days.
Thank you very
This
much
was
for your patience, because these things are important. We also would like to cure our patients, and if we know exactly how you're doing it, it's a great advantage. Thank you so much, Dr. JAVED.
Thank you, ma'am. Thank you, ma'am. Thank you, ma'am. Thank you.
Dr. Dhanesh, you are muted. Dhanesh, please, Dr. Dhanesh.
Okay, okay. Sir, we are muted it. Okay, okay.
Yes,
Just,
yes,
sir, please.
yes, yes. Dr. Rambaris, sir.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. JAVED AKHTAR, sir. Very good case. Carcinoma and symptomological angle and mental symptom. Cure the patient. Very, very thanks. According to law of homeopathic science, angle of treatment, symptomological angle is a very good miasmatical angle and pathological angle. The pathological angle treatment, therapeutic treatment, it is very difficult treatment. It is easily treatment symptomological angle and miasmatical angle. Very, very thanks, sir. Beautiful
Thank you, sir. Thank you, sir.
describe
Thank you, sir. I'm grateful, sir.
the beauty of homeopathy. You're the patient. Okay, sir. Thank you.
Sir. Thank you. Thank you, sir.
If anyone want to join the discussion, please raise your hand. And now I invite Dr. Manoj to say a few words.
Thank you, Dr. Dhanesh and Dr. JAVED Akhtar. Nice presentation. And we must remember at what situation, in fact, Hahnemann reached the theory of miasms. He describes the treatment of chronic disease. Their beginning was promising, continuation less favorable, and outcome hopeless. That was situation. Then what could be wrong? What went wrong? That was his thinking. Then he identified that there is some diseases, some causes that is not apparent, but it is latent. He searched. Then he identified certain medicines. But there is no difference whether you give this medicine, that medicine, but the selection is totally on the symptoms. But what is the role of this miasm? Through studying this miasm, we can understand one, this is a chronic disease. Second one, what is the relation between this symptom and that symptom? So I think that's very important. Dr. Beatrice.
Thank you, sir. Thank you. Thank you.
Yes, if it's possible to say one more comment. For me, it was also very impressive, Dr. JAVED. You were using the method of Dr. Seagal with the mind symptoms. So in this patient, with all the fear of getting cancer, which was a fear which we can understand in the family situation, I learned from your case also that the mental sphere is so important also in our cancer patients. He was cured by Arsenicum album, and he had a clear picture, mental picture of Arsenicum album. And of course, these swellings could also lead us to more pathological remedies like cadmium sulfuricum and other remedies with swellings here. So this case is very, very impressive. Thank you.
Thank you, ma'am. Thank you. One thing I'm going to mention here. Thank you, madam. Madam. Basically, normally we are focusing on the symptoms. Is it is the mind symptom or physical symptom? I'm going to describe at my own level what is the difference between the mind and physical level. If you take the physical symptoms are limited. Mind symptom is a broader area, number one. And number one is the second is that if you go to the depth of the case, for example, why patient is feeling what the patient feel like that. Number one, why it's happening and what is the concern of the patient. And you have to, if you remove the concerns, as the Hahnemann mentioned over there, you have to move the fears, apprehension like that. Definitely that is the highest category. But here is the something, what is the main difference between the physical symptoms and the mind symptom is the state of mind. For example, if I see a patient is suffering from certain disease and he is sitting still or looking here and there, this is observation, and you have to see it. What the patient do? If the patient visited to you are hesitating, are irritating, are not replying your answer, for example, a patient who visited to me, she was suffering from epistaxis, and I asked the question, and she was 9-10 years child, and I asked the question, "What is your problem?" She was not replying me. And then I asked it, anything else? Nothing. She was not responding. In. At last, I asked it, how many friends you have? She did not. I have asked many friends. She said, yes. Then I asked her, who is she? And she was she's mother? Yes. And she was nodding, not replying. Just I observe it. She was replying by nodding. This is the basically internal feeling of the patient who expressing during disease. These are the state of the mind what patient is suffering during. If you take these things and you can see it, after that the remedy comes answering aversion to answering by noting. Only two rubrics I taken over there. The remedy comes pastilla. You can't imagine patient was too much epistaxis over there, and as her platelets was with 15,000. After 3 hours, the epistaxis was stopped. After 3 hours, I took the sample. The platelets become 25,000, and patient was absolutely okay. This is the basically you can see the actual approach of the mind method. Other methods are very nice, but basically this what is the significance of this method? Basically, you can reach with minimum time, number one, and secondly, you can treat the as a whole of the patient. If you go to the physical symptom, you will treat the local disease, local symptoms, but you not treat it like just like the in allopathy. In allopathy, what you do? What in allopathy, I have treated a lot of cases of metastasis of the breast cancer, lymphomas. You can, I will share with you with the cured cases. If you treat the local symptom, and you will treat when you will treat the local symptom will be removed. Whole symptom will not be removed. If you select the mind symptoms, and the patient as a whole will recover, because I have seen that such a fatal cases, such a terrible cases, lymphoma, leukemia like the diseases, they are treated by the single remedy, and as a whole the patient has recovered. And what does the allopathy do? Allopathy do the local symptom. For example, I'm going to exemplify it. If you remove the cancer, for example, there is a breast cancer. You are removing the breast, but cancer metastasized. Where is the metastasized? Because you have removed every part of the tissue, every part of cell. Instead of this, the disease spread out. It means the origin is over there. They can spread somewhere else. If you treat as a whole of the patient's cause, whole the origin, then the fear you will remove it, elements are removed, then the defense system will be strong and you will patient not suffer again. I have treated that patient breast cancer who are treating 7 times chemotherapy, breastectomy. Even then, they are metastasized over there. This patient was cured by the homeopathic medicine because I have removed their fears. I have strong the defense system with the single remedy according to their symptoms, but not generally. I have this medicine. This is only I take the symptom. What you have a some people say that this kind of problem, this problem. I took the symptoms and I then rubrics were taken over there according to the patients. I have fully recorded of the patient. I never you can say use the कोई bluff नहीं मारता ऐसा नहीं होता कि आप this one no. I am making a chart, taking the with the consent of the patient, taking the videos of the patient or audio of the patients, full recorded. If someone has asked me, I want to see the audio and video, I can explain over there with all evidence, with all evidence. I have prescribed the medicine on prescription. You can buy from bazaar because patient confidence is very important.
Yes, sir. Yes, sir. Now, Dr. Tansila want to speak. Okay, Dr. Tansila. Hello, Dr.
Zila, can
Tansila.
you hear?
Please raise. She has raised her hand. Oh, now she left. Ah, yes, yes. And now, Vinay, Dr. Vinay Sweta, you can speak now. Yes.
Assalamu alaikum and namaste
Yes.
and good evening, everyone.
Yes.
I'm audible.
Yes.
Thank you, ma'am. Thank you, Dr. Zila.
Thank
Welcome,
you,
please.
thank you. Happy Teacher Day. All mentors and especially my teacher Sir Javed today very nicely explaining the case with the proof, with the medical reports and wonderful explanation of the case. And really, in every lecture, we are learning wonderfully from Sir Javed. So today, Teacher Day. And today I grateful and I thankful my teacher Sir Javed, who give us a pure knowledge about the homeopathy. And today we are able to talk about the pure knowledge, and we are treating the patients and two dangerous cases solved by the single remedy. I thankful Sir Javed, and really I appreciate to Sir Javed, especially. Thank you so much, sir.
Thank you.
Thank you. Thank you.
And now it is up to Dr. Bob Lim to say what of your question as well as you can say what of thanks.
Sir, welcome.
Thank you, Dr. Danesh, and good afternoon, good morning, good evening to IFPH. This has been a very, very good session by my good friend, Dr. JAVED AKHTAR, and also a teacher, good teacher, a mentor. He always share with us his knowledge, and it's always the mind symptom. And this is a very evidence-based session, how homeopathy has overcome a case of carcinoma, and he has many cases, I'm sure, to share. And the important thing he pointed out is to based on the mental symptom. I think it is true because it is not easy to base something on the mental system because you must get the right mental symptom. Because there are many differential remedy with that type of mental symptom. So you must be experienced and expert to pick up the correct and similar remedy. So just a bit of question before I close tonight's session. Do Dr. JAVED AKHTAR have something like a computerized repertory to help you? Is this a Sega method?
Yes, sir. Sorry, sir. Please ask again, sir. Sir, I didn't understand what you were saying.
Is there
Do you
any...
have the a computerized system to help you in the repertory of the mind symptoms?
Yes, sir. I have a full computerized system, and definitely everything is properly computerized. And our software, I have a software of such this Radar Opus software is there, sir.
Oh,
Is it based on the Sega method?
Sir,
Sega.
Radar Opus.
Sega.
Sega. This is a method. It's a name of protocol method.
Okay, sir.
It is not a software. It's a name of method. How to approach the patient. You have to learn it about this.
Thank you.
Yeah, I'm sure Beatrice also will be interested to know about that secret.
Okay, sir. I will be share, sir. You can come at my WhatsApp number and you can, sir. I can link with it, sir.
Okay,
no
sir.
problem, sir.
Okay,
it's my
as
honor.
the time is catching up, and on behalf of the IFPH, I would like to thank the audience for attending tonight's session, especially with all our great experienced people like Dr. Mano, Dr. Ran, Dr. David, and Dr. Danesh, and the rest of the team here, and including far away from Bolivia, Dr. Madam Solesco is there. For my star, Senorita, Dr. Thank you very much, Dr. JAVED.
Thank you, Bomlem. Thank you, sir. Thank you.
You will share again. Huh?
Sure, sir.
I will give you our best appreciation for sharing all the evidence for solving difficult cases. Thank you very much once again.
Thank you,
Over
sir.
to you, Dr. Narek.
Thank you, Dr. Bob Lim, and thank you, Dr. JAVED AKHTAR, sir, and those who attend the session from different parts of the world. With that, we come to the end of the day 1466, and tomorrow we will have a session from Dr. Sheetal Bitri, and she will be talking about the management of a fever with some different method that is single remedy itself. Thank you all. Good night. It's over to Dr. Mariamma John to moderate the Malayalam session.